Hello, I'm Mary Bristol, Clinical Lab Specialist at Chamberlain College of Nursing. Today, I'm going to show you how to insert a peripheral IV. To begin with, I would have checked the order, screened for allergies, risk factors, and pertinent laboratory data. I would have used my two identifiers. I would want to go and explain the procedure to the patient, perform hand hygiene. I'm going to open up my IV kit, which contains a gauze, it contains tape, a chlorhexidine wash, a Tegaderm. I'm going to take my Tegaderm, I'm going to separate it because I will only have one hand once I insert the IV, turn it upside down so I can easily grab it with one hand. I will open up my package and pre-prime my J-loop so that that will be ready with my saline flush. Cleanse, 15-second scrub the hub. And then I'm going to grab my tourniquet. My tourniquet I'm putting on now because I want to palpate my site. I want to select the site that I want to insert in. So I'm going to put it 4 to 6 inches from my site that I want to select. I'm going to use a quick release method by pulling with tension and only flipping the top down so that these are away from my site. I am then going to palpate, feel on the arm where I want to go. If the vessel itself did not puff up, it wasn't distended, I would then go ahead and use warmth, like a warm washcloth that's moistened to try to get that to pop up, or I would use gravity to help fill the vessel. I've selected my site, so I'm going to quick release my tourniquet and prepare my supplies. So the supplies that I'm going to need to pull some tape so that I have that ready. I'm going to have my Tegaderm here in the front so I can get to that. I would have had open up my Insight catheter. I would have prepared a J-loop with a clave and then flushed my clave through so that the saline is primed. Then I'm going to put that here into my clean container here so it's ready to go. Next, I'm going to put on my gloves. This is a clean procedure, so it just requires clean gloves, not sterile. And I'm going to cleanse my site. So this is a chlorhexidine, so I'm going to snap this to release the chlorhexidine. And the chlorhexidine works by a back and forth motion for 15 seconds in 2 directions. And then I can go around. And I'm going to allow that to dry. Now I'm going to reattach my tourniquet because it's 2 minutes maximum that I want the tourniquet to be on tight. I'm going to get my needle ready. Selected a 22 gauge Insight, typical size for an adult. Remove the cap. And then turn it till I see the bevel up. Then I'm going to hold on to my catheter and my hub. I'm going to stabilize the vein by pulling down with my non-dominant hand. And then I'm going, on a 15 to 30 degree angle, I'm going to put it in the vein. Once I see a flash, I'm going to push it a little further and then slide the catheter off of the hub into the vein. I can secure this with my non-dominant hand, release my tourniquet, grab my J-loop. Now I can take out my safety needle, and then I'm going to put my sharp into the container. Put pressure above the site so it doesn't bleed. Attach my J-loop, hold on to this, and then flush. It's important to get that flush in so that it does not clot in the vessel. Now I'm going to apply my Tegaderm to my insertion site. It only goes on the blue portion. I do 1/2 first. Lift this up, and then I can bring this over. I can secure my site with my tape only on the outside, and make sure that my dressing is occlusive. Lastly, I would be filling out my initials, the gauge needle, and the time and date that I had placed this IV, and I'll put it in a site lower than my window so that I can still be able to see the insertion site for my assessment purposes. I'm Mary Bristol, Clinical Lab Specialist at Chamberlain College of Nursing, and that is how you insert a peripheral IV.